For those of you I don't know, I'm Andrew Janower. Along with the Ragnonis and the Gainies, my wife Cindy and I are co-founders of the Kids Brain Tumor Cure Foundation. On behalf of the foundation, I want to thank you all for coming tonight. First and foremost, in these two rooms, we've got a number of key members of the Dana Farber Low-Grade Astrocytoma Research Program, led by Dr. Chuck Stiles and Dr. Mark Kieran. Thanks to both of you and to all of the other researchers here tonight for your tireless work in advancing our understanding of pediatric brain tumors. We've also got tonight our Foundation's Distinguished Scientific Advisory Board, who travel from around the country to come in to help us set priorities for future research funding. So thank you for taking time out of your busy lives for helping sharpen our thinking. My sister Amy Weinstein, not just a videographer, but also the executive director of our foundation, and our many friends in the room who, each in your different way, have been kind enough to support us on our journey. We're so glad you could join us tonight so that you can see firsthand the impact of your philanthropy in curing this pernicious disease. Most importantly, to the parents, siblings, and brain tumor survivors in the room. Nathan, Kelsey, Dimitri, TJ, Jake, who's not here, Lexi, Caroline, and last but not least, Samantha. You're why we're all here. Sorry if I embarrassed you. I just got that look like you are so deadly. Your courage confronting your disease inspires us to be our best selves and provides us all with the resolve to do the hard work required to find more effective treatments for brain tumors like yours. Cindy and I first learned about Samantha's diagnosis when she was 3, almost exactly 11 years ago tonight. I can still remember the pit of my stomach outside the radiologist's office at Children's Hospital when she gave us the bad news. Our daughter had a brain tumor about which very little was known, and for which the current treatment alternatives were far from optimal. Even more discouraging, as we were soon to find out, despite billions of dollars going into cancer research, we soon learned that pediatric brain tumors were a true orphan disease, which garnered shockingly little attention in the scientific community. Doctors and researchers told us they couldn't afford to focus on curing these tumors because there was no funding. And the traditional funding sources told us they didn't invest in the area because they couldn't find adequate proposals. So in the business world, we call this a doom loop. And that's what we set out to change. And I look around the room tonight, not just all the people here, but all these posters which represent man-years of hard work, and it really touches my heart. 10 years later, after thousands of miles biked, not just by me, but by many, walked or run at the PMC, the Jimmy Fund Walk, our foundation's annual Geared Up for Kids event, which almost everybody in the room has been to or involved or donated to at least one of those, and scores of other events hosted by similarly situated families around the country, we can be proud of what we'd accomplished to date. Here at the Dana Farber, the program has mushroomed over time, leveraging our initial seed investments, your seed investments, to access multi-million-dollar NIH grants that couldn't have otherwise been secured by the institution. And this year, I'm told, we had the attention of over 100 scientists working on the program. Is that right, Chuck? Still over 100? 100 working to help us find a cure. We've got several other leading cancer institutions around the country, and with the recent grant from our foundation, now also in Europe, working on collaborating on the problem. And I think we're making progress. Barbara, you were asking me earlier, what's it going to take so that we don't have to come to events like this anymore? How long is it until we have a cure? I don't know the answer to that, but hopefully soon. And we do have a clinical trial that's about to launch. It's one of a series and a pipeline of other promising new compounds coming up that we hope will ultimately make meetings like this. I'm sure they'll be necessary for other cancers, but hopefully not necessary for this cancer. So it's clear that there's still a lot left to be done. And while the brain tumor families in this room, each of us, are fortunate in so many ways, there's still a lot of kids who are less fortunate and for whom the best treatments currently available is not enough. And so we feel like we have to do better as parents, and we can't do it alone. We can't do it without your help. We're so grateful that you're here tonight. We're grateful for the help that you provided us to date, and thank you for being our partners in this life-changing journey. And with that, I'll turn it to Dr. Kieran. So
TJ asked me to say a couple of words. He didn't tell me he was going to say the same words just before. So let's see, what didn't he talk about that I could add in? I'm not going to embarrass Samantha, so at least I can do that. So, you know, obviously there are a lot of familiar faces here, patients, families, and certainly colleagues, and we want to thank you guys for making the effort to come here. Cold winter's night in New England obviously is a lot of fun. There are lots of other things you could be doing, probably better food you could be eating, and we recognize what it means to actually pull yourselves away from family and friends to do this. I think obviously I have a somewhat different perspective on this because obviously I remember some of the initial families when the Gainies first came and started to raise this issue of how could we not know anything about this tumor or how to treat their children. And it was a hard and sobering fact that we had to kind of admit that even here at Harvard, as was true for every other place in the world, we really knew virtually nothing about these tumors. Right? It's not breast, prostate, colon, lung. It doesn't get all the NIH funding. It doesn't get all of the kind of publicity and focus. There are way fewer numbers, so drug companies aren't interested, scientists aren't interested, funders weren't interested. And it was a kind of wake-up call when they said, here, we're going to put a little bit of money together and we want you to kind of begin to understand. And fortunately, we were somewhat successful. In fact, that first set of experiments led to a clinical trial, which meant we could actually offer a new therapy for children. But more importantly, a couple of other families got together, and you've obviously already seen the kind of trio of the Gainies, the Janowers, the way that the different families have really come together to create this new infrastructure that has allowed us to do things that we otherwise couldn't do. And in particular, so for those of you that don't know Chuck Stiles, Chuck Stiles is really perhaps the most important person in the room. Because when
the Godfather.
Yeah, when the Ragnonis, the Janowers, and the Gainies came and kind of said, listen, this has to be on a much more thoughtful level, I knew it was way beyond what I could do. And the first person I went to was Chuck Stiles, head of cancer biology here at the Dana Farber at Harvard, and said, based on what the families are proposing, which would be a real endeavor to understand what's going on with these tumors and make an impact that has never been attempted before, would you get involved? And so for those of you that don't know Chuck, he's certainly in his own right a world expert in neurobiology and in the development of pathways that treat more aggressive tumors, and he jumped on this and said, absolutely, we can do this. And he, as you can see, put a tie on, still has almost the blue jeans on. He normally walks around, he's one of those kind of scientists that walks around in blue jeans, and I suspect he would smoke a pipe if he was allowed to have one. But he has really kind of brought the science, not just to the scientific community, but also to the families, and for the families that have had a chance to work with him and know what I'm saying. And that opportunity to bring Chuck in, which then allowed the families to really begin to focus their efforts on someone who could really move us forward in a way that I think we were deserving of, is what's accounted for much of the success. And as you've already heard, we now get multiple international collaborations, we have international grants, we have big funding from the NIH. Does it come close to doing what needs to be done? No, it doesn't. It barely even touches the surface, but at least there's some awareness now at the NIH and the NCI that there are issues going on in kids that need to be addressed, and sometimes just having a little bit of that awareness, again, in large part out of the group of families that have started this whole endeavor and their efforts in Washington as well, I think has been important. And so where we kind of stand now is from not even being able to tell him what causes these tumors, what the mutations are, or how to treat them other than with just traditional surgery, chemotherapy, and radiation. We now have a large number of the mutations characterized and understood, and as you've seen from some of the posters, we're in our 5th clinical trial for actual drugs that are targeting these, not drugs that are chemotherapy that do all the usual damage, not radiation therapy. These are drugs that look at the mutation of your child's tumor and treats that mutation while avoiding all of the kind of collateral damage that has been classic for the approaches that we used, certainly when I was training as a neuro-oncologist. And that, in and of itself, is an enormous excitement. And you could kind of conclude out of that, okay, we're done, everyone can go home, we've solved the problem. The issue is we haven't come close to solving the problems. Remember, in 2007 when we started, Not a single mutation was known for this disease, and now we've discovered at least 2/3 of them. We have multiple clinical trials. But those clinical trials are not perfect. Those clinical trials also have toxicities. We don't understand why the mutations happen. We don't understand how to prevent them. We still don't have therapies that have no toxicity. Obviously, we want for your kids what we want for our own kids, and that is to grow up, to be strong, to be healthy, to have families, to go to school, to get the kinds of jobs and have the relationships that any parent, grandparent would want. And unfortunately, we've made a lot of progress with your support, but we have an enormous way to go. And as you look around, you'll still see a lot of the biology because we're still learning about the mutations. Actually translating that into effective therapy for every child is still a long way to go. In fact, as I said, for 1/3 of the tumors, we still haven't even discovered the mutation yet. So we have a lot to do. And the reason you're here, I think you know, is A, to see what's happening, because we think it's important that if you're going to support it, you need to understand what we're doing, why we're doing it, and how we're doing it. But it also tells you that there are a lot more bike rides to happen. There's still a lot more walking, bake sales, and so forth. We're absolutely 100% committed on our side to do our part of the job, and we're relying on you guys to help us do that. And if we do this together, there really will be a day not that distant in the future where you really can't stop coming to some of these events. And that's our goal as well as your goal, we know. So thank you for coming. Again, we can't thank you enough.